Hi, everyone. Welcome to this month's webinar. We'll get started in just a minute. All right, we'll go ahead and get started today. We've got a lot of exciting things to cover. Hi, everyone. Good afternoon, good morning, good evening to those of you joining from around the world. My name is Ryan Kronk, and I'm part of the UNC Secretariat who leads the Washington Healthcare Facilities Community of Practice. We're really excited this month because this is a topic near and dear to our hearts on evidence for policy and practice. And we've got a really great presentation today on a comprehensive mapping of the Washington healthcare facility literature. So I just want to go over a couple announcements, um, and then I'll introduce our speaker, and then we're going to have a twofold discussion, one a Q&A with our presenter, and then we're gonna spend the back half of the webinar discussing with you all critical research priorities for policy and practice in Washington healthcare facilities. So I hope you all, throughout the presentation, you'll be jotting down ideas, and you'll drop those into the chat. And if you're willing and interested, unmuting and kind of engaging in this dialogue around on Washington healthcare facilities research. So just some announcements. We've mentioned this several times, but the faith-based organizations in Washington healthcare facilities working group is launching later this month. If we're still working on finalizing the specific topical focus of that, but if you're interested, please email Nikki. Her email's there and it'll get dropped in the chat if you need to follow up. Also, I forgot to mention, if you'd like to introduce yourself, you can drop your name and organization in the chat, just so folks know who everyone else is on the call. Save the date for our next webinar, which will be on Thursday, July 9th. We have a really exciting webinar from the Promise Consortium. And they are a collection of partners who, an international partnership that strengthens the capacity for evidence-based sanitation and hygiene policy and works on efforts to integrate that in policy planning, finance, and implementation. So the details for that are in the chat. We would love it if you went ahead and registered for that, so you have it on your calendar for July. I know that's skipping ahead. That's when they were available. We may have additional webinars this summer, but just wanted to flag that for you all. I also wanted to flag that some of you may have attended the Rome event. That was around faith-based organizations and allies who are committed to Washington healthcare facilities. It's a really successful event. That whole event was live streamed and is now recorded and on YouTube. You can access it each session individually on YouTube in English, and you can watch the whole webinar if you'd like, including in other languages. It was recorded and translated into Spanish, Italian, and French. So please check out the link in the chat if you'd like to go to the webpage. There's lots of other great resources there, and we'll continue to populate that with resources as they become available, including a meeting report. You can also see commitments that organizations have made. So we'd love for you to check that out and check out all the great resources. There's also a really great timeline of engagement in Washington healthcare facilities that you can download on that page. Finally, we as always, we want to hear from you. If you have a project or success story that you'd like us to feature in our newsletter or have an idea for a future webinar, we're always looking for content. We're always looking to have this to be a bottom-up community where you all kind of feed us ideas so that we can curate and identify key partners and stakeholders and bring together this community to strategically advance Washington healthcare facilities. So if you have ideas, please feel free to drop them in the chat or send us an email. We have a dedicated email for the COP, which you can see on the screen and you can grab from the chat. So with that, I am going to turn it over to my colleague, Lucy Tantum. Lucy is a PhD student here at UNC, soon to be Dr. Lucy Tantum. Her defense is coming up. But she she has done an amazing piece of work that I'm so excited to have presented and to officially launch. It was just published in the International Journal of Hygiene and Environmental Health about a month or two ago, and we will drop the link to that resource in the chat. I'm really excited about this because I have long seen the need for a mapping of evidence. There's been so much action on wash and healthcare facilities over the past since 2014 when this whole initiative really kicked off. But I have been concerned that we're overinvesting research in some areas and underinvesting in others. And so Lucy really embarked on this incredibly arduous task of mapping all of the evidence in this space. And there's a lot of familiar pieces of work that some of you all, have contributed to and may be aware of, but we actually uncovered quite a lot of evidence that's produced outside the wash field, which we're really excited about. So, without further ado, I will turn it over to Lucy to present. As she's presenting, feel free to drop questions in the chat, and we will do a Q&A immediately after she finishes, and then we'll pivot to a brief internal discussion on research questions, and then open up the floor for you all to engage. So get your gears turning on research questions so that we can have a really great discussion in the back end. So thank you, and take it away, Lucy.
Great. Hi, everyone. Good morning or good afternoon. Hopefully, you're all able to see my screen. Um, yeah, so like Ryan said, I'm a PhD student at UNC, where I work with the UNC Water Institute. And today I'll be talking about a project on mapping the evidence on environmental health services in healthcare facilities. I will start with an overview of our evidence map project in terms of the background, methods, and some key results. And then I will also demonstrate an interactive data visualization that we've created, which accompanies the evidence map. So first, to start with a little bit of background and methodology for why we chose to do this and how we did this. So as I'm sure everyone on this call knows, environmental health services are essential for safe and quality care in healthcare facilities. So these include services for water, sanitation, hygiene, waste management, cleaning, and laundry, also known as WASH in healthcare facilities. I'm using this term of environmental health services to convey that we're not just talking about water, sanitation, and hygiene, but rather this whole package of keeping the healthcare environment safe. And these services play a key role in preventing infection and supporting the health and well-being of patients, healthcare workers, and everyone who interacts with healthcare facilities. However, in many low and middle income countries, healthcare facilities face gaps in coverage of these key services. And this is especially true in fragile contexts. So this figure is from the Joint Monitoring Program's 2023 report showing the coverage of environmental health services in fragile contexts. And while over 60% of healthcare facilities in these areas had basic levels of water services, fewer than half had a basic level of sanitation, hygiene, cleaning, or waste management, which is a problem that, again, puts workers and patients at risk. And in a global report, the WHO and UNICEF raised the issue that measured against global targets, progress toward achieving universal access to environmental health services in healthcare facilities is off track. And we need to accelerate these efforts and scale them up and if we want to actually achieve benchmark levels of access. So then the question becomes, how do we actually accelerate and sustain access to environmental health services in healthcare facilities? And one of the frameworks that's been proposed to actually improve access to these services is the 8 practical steps. This was a framework that was developed by the World Health Organization and UNICEF, and it proposes different actions that countries can take to improve environmental health services. And these include actions that could happen at the national level, so things like setting targets, making a costed roadmap, establishing national standards, as well as actions that might occur at the level of the healthcare facility or subnationally. So things like conducting an analysis of the current situation, improving infrastructure, developing the health workforce, engaging with local communities, conducting operational research. And so we kind of we formulated basically a hypothesis that research could inform these different practical steps. So you can kind of think of this as a continuum. Obviously, these 8 practical steps are not always implemented in sequence. It depends on the situation, but we can think about this as a process where you have steps that relate to forming policies and guidelines, steps that relate to implementing programs, and then long-term sustainability and growth. And so we thought that research could inform each of these steps and ultimately help to accelerate progress. So help us understand where are the key barriers to progress and how we can move forward. So with this, the research questions for the evidence map were, first of all, to what extent have environmental health services in healthcare facilities in low and middle income countries been studied to date? Where are the major knowledge gaps and areas for further research? And then how can this evidence inform policy and practice? So the objective was to curate the available evidence on environmental health services in healthcare facilities, in LMICs, into a repository that could support decision-making and the formation of targeted research agendas. So like Ryan was saying earlier, there has been so much research ongoing in this field, but it hasn't necessarily been consolidated in order to really understand what is the current status of knowledge and where do we need additional work. And in order to accomplish these objectives, we used a systematic evidence mapping approach. And I'll just talk a little bit about what this means. So you might be familiar with a systematic review, and an evidence map is similar. So basically, it is a systematic search for research within a certain scientific field. So you have a protocol for the way that you're searching for research and including it in the map. However, compared to a systematic review, an evidence map is typically very broad in scope. So your research questions and your searches are really trying to cast a wide net. And the goal of an evidence map is typically to identify research gaps and trends and produce some kind of searchable database or visualizations that can help to interpret your findings. And evidence maps are typically created with an eye toward policy and practice priorities. So getting beyond just the academic research scope and actually thinking about how research can inform practice. And evidence maps have been created for other topics that relate to environmental health as well as WASH, but to date, there hasn't been evidence mapping on environmental health services or WASH in healthcare facilities. Like I said, evidence maps typically have broad criteria of what you include and what type of research you search for. So for our study, we had 3 main eligibility criteria, which a study had to meet in order to be included. So the study had to take place in a low or middle income country setting. It had to examine 1 or more environmental health services in healthcare facilities, and we defined this to include water, sanitation, hygiene, waste management, cleaning, and laundry. And it had to take place in a healthcare facility setting, including any type of specialized or general, large or small facility. And if a study met all of these criteria, we included it. So we didn't place any restrictions on the study type. Any research study was eligible, whether or not there was an intervention or a comparator, et cetera. And we also looked at research from 2008 until 2025. Because 2008 was when some of the first guidelines were developed globally for environmental health services in healthcare facilities. So in terms of the methodology, so we first began with a systematic literature search. So again, we were looking for these kind of 3 categories of environmental health services, healthcare facilities, and LMICs. So we developed search terms for each of these. We then performed searches in scientific literature databases to find studies that might be relevant based on containing some of these key terms. We then conducted title abstract screening. So we looked at the study title and abstract to see whether it was relevant and whether it met all of our eligibility criteria. And here we used a machine learning process to help cut down on the number of studies that we had to screen manually by automatically excluding some of the irrelevant studies. And then we also performed manual screening. We then had a step that we called literature inventory tagging. So essentially, with each of the studies that we included, we categorized it in a few different ways. So we looked at the environmental health service that it examined, the methodology, and how it was relevant to the 8 practical steps. So whether the study pertained to baseline assessment, policy analysis, intervention research, etc. I'll talk a little bit more in the results about how we categorized there. And then we synthesized these data. So we described trends and research gaps, and then also developed this interactive dashboard that I'll share a little more about toward the end. Great. So now I'll move on and talk about what we found. In terms of our literature search, so like I said, we cast a very wide net, which yielded a lot of studies to go through. So after searching in the scientific databases, we had about 37,000 studies that came up as meeting at least one of the keywords that we were looking for. We thankfully had this machine learning process to help us cut down on manual screening, thanks to the librarians here at UNC, but we still had to manually screen over 13,000 studies. And then of these, about 4,300 met all of the eligibility criteria, meaning that they took place in an LMIC, in a healthcare facility, and examined environmental health services. And we included these in the evidence map. And I'll talk a little bit about some of the key trends that we saw in these 4,000 plus studies. So first, we found that most studies examined hygiene at the point of care. So this included hand hygiene during clinical care, as well as usage of personal protective equipment, such as masks or gloves. So we found that about over 60% of studies in the evidence map pertained to hygiene at the point of care. And this also reflects the fact that our evidence map was somewhat interdisciplinary, where we were not just looking at research from the WASH field, but also there is a good amount of research from like the kind of clinical infection control field that does talk a lot about hand hygiene and the healthcare environment. So we were able to tap in a little bit to that discipline as well and pull some research on hygiene from that area. We also found a substantial number of studies looking at waste management and cleaning, and then fewer than 10% of studies examined services related to water, hygiene in non-clinical areas within healthcare facilities, sanitation, or laundry. And then this figure is showing basically the different methods that studies used to collect and analyze information, as well as the different services that they examined. So if we look at the methodology here along the top, we can see that most studies were cross-sectional surveys. So this means that they were measuring conditions at one point in time using a quantitative method. And across all of our different environmental health service categories, we saw that these cross-sectional surveys were very common. In comparison, we saw relatively fewer that conducted a longitudinal survey, so maybe measuring conditions and looking at changes over time, or a qualitative study. We also looked at studies that might have been looking at measuring changes associated with an intervention. And we found that there were some that looked at interventions using non-experimental methods, so maybe looking before and after, or using a quasi-experimental study, but very few that were actually experimental, so using a randomized controlled trial. And in general, there was a lot less research around interventions compared to cross-sectional assessments, which just kind of report on what the conditions are at one point in time. And obviously, that's very useful to understand the current situation, but might not always be providing insight for how well an intervention program actually works. And then along very similar lines, we found that most studies were baseline assessments when we were looking at their relevance to the 8 practical steps. So a lot of studies involved baseline assessment or situation analysis, so reporting on what the conditions were and trying to understand maybe some barriers or drivers of the current environmental health services. In comparison, we didn't see very much research around the policy-related steps, so setting targets, creating costed roadmaps, establishing national standards. There was very little research around these areas. And that might also reflect the fact that these processes are not always involving researchers. That's happening often more on the policy side, but still an area where there might be a bit of a knowledge gap in terms of how research could inform best practices for costing, budgeting, guideline development, and policy. And then step 4 here is improving and maintaining conditions. So that was for research that related to interventions or some kind of program to improve environmental health services. And again, here we saw relatively low numbers of studies compared to the baseline assessment category. And then step 6, developing the health workforce. This was studies that looked at either a healthcare worker training program or measured knowledge or behavior among health workers. And again, we saw a pretty good number of studies in this category, especially around hygiene at the point of care. So lots of studies looking at hand hygiene behavior, as well as knowledge among healthcare workers. And then we found that studies took place in 109 low and middle income countries. So this research was very global, spanning lots of different countries and settings. We saw the highest concentrations of research coming from countries like China, India, Iran, Ethiopia, and Nigeria, but quite a bit of research from different countries and world regions. And we did see a increase in the research over time. So we looked at the number of studies that were published in each year since 2008 when our search began. And we saw quite a bit of an increase, especially with an uptick beginning in 2020, which, as you might imagine, is likely related to the COVID-19 pandemic and increased interest in environmental health, especially around hand hygiene and infection control during the pandemic. So we see this big increase, and the purple bar here is showing hand hygiene or hygiene related research, and we see that that especially increased in 2020 and then moving forward. And maybe there's a bit of a drop off again in 2024, but still a substantially higher number of studies compared to pre-pandemic. And I will note we conducted this search in the very beginning of 2025, so data for that year are minimal. Obviously, there's been a lot more coming out since then. And then along similar lines, so we also looked at how many studies examined or reported on conditions in the context of COVID-19. So either they talked about how to improve and sustain environmental health services during COVID-19 or talked about the impact of COVID on these services. And we found that about 27% of studies contained these themes. In comparison, we found that 3% contained themes that related to other disease epidemics. So they talked about environmental health services in the context of Ebola, flu, other diseases. 9% focused on maternal and child health settings, so looking at services specifically within the context of a maternal or child healthcare provision setting. And then very few, only 1%, looked at impacts of climate or climate resilience of environmental health services. I'll just go through a few key takeaways, one of which is that, as I highlighted a few times, evidence is unevenly distributed across topics and study designs. So we found a lot of evidence on environmental health services, and there has been a lot of research in this area, and it's a topic that's been growing in popularity. However, this is not necessarily distributed evenly among all of the topics that we looked at. So while there has been a lot of research around hand hygiene, there's been relatively less around conditions for water, sanitation, or laundry. And this could pose an issue for actually developing guidelines or interventions in these areas if we don't have a strong evidence base to support them. Similarly, we found that most studies were baseline assessments and cross-sectional surveys. And then there might be a need for more research around other practical steps, especially around policy analysis or intervention research. And this could help to inform progress on these steps and help decision makers understand how they can actually use evidence-based practices. And we hope that this evidence synthesis can actually help to guide future research and decision making. So we found a lot of really interesting research, including a lot of really descriptive and rich studies across all of these areas. And so we're hoping that having this evidence map can help to highlight that and hopefully use research to inform decision making in the future. And then finally, if you'd like to read the full paper or go back and look at any of those figures or data points more closely, we have a link to the full text, which I think we can also share in the chat. Just to note, this will provide free access to the full text until May 7th. So I recommend that you go on and download the PDF today while it's available. Unfortunately, after that, it'll be behind a paywall. Even then, though, you're welcome to get in touch with our team, and we'd be happy to help with sharing that PDF. Okay, so I think in that case, I will move on, and I'll just make sure there's something in the chat that I need to address here. Um, Great, so I'll move on, and I will talk a little bit about the interactive data dashboard, which we've created and which accompanies this evidence map. So I'm actually just going to switch my screen share really quickly to show this dashboard. Great. So hopefully you're now seeing my browser screen. And so one of the key objectives of the evidence map was to create something that could actually be useful for practitioners and help to inform decision making. And we know that a research paper is not always the best way to do that or the most digestible to someone who's just trying to find information quickly. So we also developed this data dashboard, which provides an overview of the key trends in the evidence map and allows you to really explore the data yourself. So this dashboard is hosted on the Tableau platform and it's interactive. So we have over here on the right, we have a list of all the studies that we included in the evidence map. As you can see, it's quite a long list. Oh, and now my, my screen is recalibrating. And then, sorry, it's a little slow to load when I'm screen sharing, but I think I can still hopefully show this. And then here on the left, we have different visualizations, some of which I took screenshots of for the presentation earlier. So we have different heat maps and different visuals showing our different research that we found. And the great thing about the dashboard is that it's actually interactive. So you can click on any of these elements and be able to actually filter down and look at the information more closely. And because it's a bit slow to load, I'm going to switch back over to the PowerPoint slide and I'll go through a quick case study there. Great. So yeah, sorry that it was loading a little bit slowly, but basically, so yeah, like I was just saying, this dashboard shows different visuals that convey different elements of the evidence map, including the different environmental health services, publications over time, geographic trends, and then as well as a full list of all of the included studies. And I'm going to show a little case study of how someone could use the data dashboard for a rapid literature review. And for this, we can imagine that you're interested in learning more about sanitation in healthcare facilities. And I'll show you how you could go about actually finding information within the dashboard relevant to this question. I mentioned, the dashboard's interactive and you can actually filter by any of the elements. So for example, one thing that you can do is if you want to look at studies around sanitation, you can click on the sanitation row in the heat map and it will now filter by this category. So if you click on this, you'll then see that the dashboard is filtered and now it will only show studies that relate to sanitation. So basically, these other visuals and heat maps have also been filtered down, and the list of studies now only shows you the studies that relate to sanitation. So this is now a much shorter list of studies that would be easier to go through and actually try to find something that you're interested in. And then you might have some questions that you want to explore. So for instance, what types of study designs have been used to examine sanitation in healthcare facilities? So here we can look at the heat map of study methods, which has now been filtered to only show sanitation studies. And so here you can see that there have been over 170 cross-sectional surveys on sanitation in healthcare facilities. So if you're looking for some basics of how is sanitation usually measured and reported, what are the conditions like in some settings. You could probably find some good research there. We also see that there's 39 qualitative studies. So maybe if you're interested in looking at user experiences with sanitation, there could be some insights in that area. And then we see relatively few interventions. So 9 non-experimental interventions and 1 experimental study that included sanitation. So if you were looking at maybe designing a study of your own, you might see this as an evidence gap where you could design an intervention around sanitation and build on this research. You might also wonder along those similar lines, what strategies have been tested to improve and maintain sanitation services? So here we can go to this dashboard of the 8 practical steps, and we can look at studies that relate to step 4 around improving and maintaining conditions and that relate to sanitation. And as you can see, there are 25 of these studies. So these are studies that report on interventions, quality improvement programs, other changes to improve conditions. So this could provide insight for your own programming in terms of what has been done before and where are there actually evidence-based strategies to improve sanitation. You might also be curious to know what research has taken place in recent years. So what is the state of the art in terms of sanitation research? Are there any new technologies or new methods that are being developed? So here you can look at this graph of time trends. Again, this has been filtered down to only show studies that relate to sanitation. And you can see that there has been quite an increase in recent years, especially from 2021 onward. And if you want, you can even click on a specific year. So if you want to just look at what came out in 2024, you can click on that year, and then now you'll see the list of studies that have been published in that year. You might also want to know what research has taken place in a country or region where you work or where you're interested in working. In this geographic map, unfortunately, due to the limitations of the dashboard, we weren't able to make it be filtered by topic in the same way. However, you can still click on a country to see the studies that originate from here. So this isn't just showing sanitation studies, it's showing all the studies across all categories. But for instance, if you're looking at programming that might have happened in Peru, you could click on Peru, see that there have been 21 studies that took place there, and then learn more about those and what research has actually been happening in that context. You might also want to know about how sanitation overlaps with other key areas of interest. So for instance, how much research is there on sanitation in maternal health settings? So after filtering by sanitation in the dashboard, you can go down to this graph of different study topic focuses, and you can see that there are 49 studies that relate to sanitation as well as to maternal and child health. And if you click on this row now, then you'll be filtering down to just these studies. So now you can see a list of 49 studies that look at sanitation in a maternal or child health setting. And then finally, you might also have other interests that we didn't necessarily catalog in the evidence map. And we do have a keyword search field as well. So you can search for a term and look at the list of studies that relate to that term. So for instance, if you're interested in thinking about how sanitation intersects with accessibility and disability in healthcare facilities, you could do a keyword search and find studies that relate to that topic. I will note that this is just limited to information in the title and the abstract. So you might need to try a few keywords in order to get an idea. It might not be an exhaustive search, but it's a great way to learn a little bit more about what's available. And to know what journals are publishing research on sanitation in healthcare facilities, either if you're looking to publish your own work or if you're trying to think about journals that you might want to follow and read a little more about. So this list of journals has also been filtered by the sanitation category. And we're looking here at the frequency of publications in different journals. So here we can see that most of the studies on sanitation have been published in Journal of Water, Sanitation, and Hygiene for Development, BMC Health Services, or a few of the PLOS journals. So these might all be areas to look out for if you want to learn more about this topic. And then finally, if you want to download a list of studies to review in more depth later, there's a way to do that, which I think is one of the best features of the dashboard. So I've just been showing so far how you can view things within the dashboard, but you can also export a list into an Excel document, which you can then go back and reference on your own. So if you click on any of the rows, columns, or cells in the dashboard, you'll see a menu. And then you want to click the View Data icon, which is these little three lines and dots. And then when you click on that, it'll open a pop-up window, which contains a full list of all the studies in that category. And then this list can now be downloaded and exported so that you can look at it later. So this is a way that you can maybe have a starting point for your own literature review on a topic of interest. And then this was just a really rapid overview. So if you want to learn more about how to navigate the dashboard and how to interpret what you're seeing, just to note that we do have a little About tab at the top of the page. And if you click on this, it will open up some more information about the dashboard, including an overview of what each of the visualizations are showing, some definitions of key terms, and some navigation tips. And yeah, so here's a link to the dashboard, and we would obviously love for you all to go and explore it on your own and see how it could be helpful for your own purposes. And we'd love to also hear about anyone using the dashboard and how it has helped you or how you've been using it. So we hope it can be a great resource for this community. Great. So I'll just end with a few acknowledgements. First of all, to the UNC Water Institute, especially Ryan Cronk and Darcy Anderson, who were instrumental in planning and creating this project, as well as Emily Jones in the Health Science Library, who helped with our systematic search process. We also had a really great team of UNC undergraduate students who were involved in screening tagging studies and building the data dashboard. As you saw earlier, it was a huge number of studies, and we had a really great team to help filter through all of those. And then finally, we received funding from the Wallace Genetic Foundation, as well as the NSF Graduate Research Fellowship Program, and I'm very, very grateful for the support. Great, thank you. That's all I have, and I'm happy to open it up for questions or turn it back over to Ryan. Thanks.
Yeah, thanks, Lucy. If you have a question and uh, would like to post it in the chat or raise your hand, please feel free to do so. There were two that came in, Lucy, if you think you might be able to respond to these. There's a question about um, indoor air quality, and colleague mentioned that they've noticed that this is a can be an issue in healthcare facilities, in larger facilities that have cooking facilities. I'm wondering if you could reflect a bit on why that was out of scope for this review, or some of our decision making behind why we didn't look at that.
Yeah, thank you. Thanks for asking. And yeah, it definitely is a really interesting topic that does have a lot of overlap with other environmental health services and healthcare facilities. We we tried to base our scope off of a few things. So one of which was aligning with the current global guidelines around environmental health services and healthcare facilities. So we chose to focus on the services that are currently monitored under the WHO and UNICEF joint monitoring program and included in those guidelines, just to kind of be adhering to that framework. It was also just a practical matter of the volume of studies that we could actually look at. And I think we even did play around with including some terms for air quality, and it was hard to do that without like totally blowing up the search. So I think it would be really interesting, but might need to be explored separately in a more targeted way rather than as part of this broader study.
Yeah, thanks. The other question we regularly get is why we didn't include energy. And that was similar to the reasons Lucy mentioned. We had to draw some bounds somewhere to make the search somewhat reasonably manageable. We actually didn't expect to even return 4,000 studies, so it was a much larger effort than we anticipated. The other thing is energy was also addressed through another review, which we can certainly share. So we felt we could exclude that from our project. The other thing, though, with the beauty of the interactive dashboard is that you can any study that also talks about wa wash and environmental conditions and indoor air or energy would also still be included as long as it included one of our core elements. So there it is possible to find energy related studies and air related studies. Um, this next question from Nuhu asked, despite the many hand hygiene research, our recent research found that only 9% of hand washing basins had soap for hand washing. Have you searched the causes of poor soap availability? So this is almost a good case study set up for how to potentially use the Tableau evidence map to look into this. If you have any quick reactions, Lucy.
Yeah, thanks. Yeah, it's a great question, and I think it would be really interesting to explore that with the evidence map. I guess in terms of like how I might go about looking into that, so one of our categories that we looked at with the 8 practical steps framework was around formative research. So we actually kind of almost added an intermediate step here between step 1 and step 2 of studies that were looking at barriers, facilitators, drivers of safe environmental health services in healthcare facilities. So, for instance, studies that might examine barriers to availability of soap and hand hygiene. So, I guess one thing you could do is look at studies that are around hand hygiene and then also looking at this formative research category, and that might yield some insight. I think also just from other research I've worked on in this area, I think a lot of that does come down to like supply chains and sustainability. So it might be possible to install a sink, but then actually setting up a system for monthly procurement of soap and being able to fund that and support that is kind of a different management task. So that's maybe one of the explanatory factors there.
Great. Thanks, Lucy. The other thing I will plug, because I found this really useful, in the evidence map, you can actually search, there's a search bar, and it will query all the titles and abstracts of the studies that were included. So you can actually look for quite niche topics and find specific studies. Like I was looking the other day for faith-based actors and studies that were conducted and was able to yield several studies. So please don't hesitate to reach out if you have any questions. Um, on how to use the evidence map, or if you have particular research ideas, we'd love to work with you to help you achieve your goals or collaborate or that sort of thing. So we'd be more than happy to engage with you on that. So again, please make sure you grab. We'll make sure to circulate the links again in the upcoming newsletter, but please feel free to grab um, the links that Nikki has dropped in the chat. So with that, I want to pivot just so we have a little bit of time to interact with our other team. So we changed this webinar at the very last minute based on the outcome of the Rome meeting and wanted to have a brief discussion about research and how we go about tackling that. So as we talk, I'd love for you to, as you've had ideas come up, if you could drop those in the chat. And so I'm just going to turn to our my other three colleagues at UNC. Nikki, and I'll just kind of give the questions in advance so they have a second to think about them a bit more. But Nikki, Nikki's been leading behind the scenes an effort to do deep dive systematic reviews from this evidence map. And I'm wondering if you could just talk about those briefly and maybe highlight some of the key challenges that are emerging or research priorities that you might see emerging. And then Darcy is our resident expert implementation scientist, one of our senior research scientists in the Water Institute, who's been working with me in Washington healthcare facilities for quite some time. Wondering if you could just reflect on research priorities related to implementation and sustainability. And then Lucy's been doing a lot of other work as well, which we hope to present at a future webinar. And one of the key highlights that one of the key things that the evidence map highlighted was the fact that there's almost no experimental or intervention type studies to understand with the highest quality evidence, um, what are the impacts of wash in healthcare facilities on health and non-health benefits. And obviously, we know in the era of funding, foreign aid funding cuts, running randomized controlled trials are expensive. And Lucy, I'm wondering if you could reflect on some of the work that you've been doing on sort of some innovative work with our partners with World Vision around using secondary data to look at impact evaluations and how those types of designs may help yield really valuable information for to drive this agenda forward at much lower costs than running a randomized trial. So those are the questions. Please feel free to keep dropping questions in the chat, questions for the panelists or research questions, and I'll turn it over to Nikki to respond first.
Yeah, thanks, Ryan. So as Ryan mentioned, I've been helping lead a handful of kind of mini reviews from this evidence map. Um, a couple. There are five of them, I believe. And so we basically took this 4,000 plus studies and using the tagging, which was really helpful because it helps narrow it down, using the tags that Lucy developed with the help of some undergrad students and applied to all of the studies, we were able to narrow it down into one review that's focused on wash-in healthcare facilities in fragile contexts. So we use the World Bank classification for that within 2 years of the study date. We did one on results-based financing models for wash-in healthcare facilities and how they relate to environmental health conditions. We did two on climate, and they were both on climate resilience, but one was focused on software, like management and policy style interventions, and one was focused on hardware infrastructure type interventions. And then we did one on water intervention. So we wanted to specifically dial down on not just the very small handful of studies that focus on interventions and actually report on interventions, but also how those relate to water supply, water quality, and so on. And one of the things we definitely found, and I'm stealing a little bit of Darcy's thunder here, sorry about that, is that, yeah, there really is a lack of information about interventions and how they work and whether they work, the extent to which they work in healthcare facilities. Um, and we found that in water, we came up with, I think, 16 studies when we finished the screening, but many of those weren't randomized. It was there is a lack of kind of high quality intervention style studies in this space, which has been reported on before by colleagues at London School and so on. Same thing in fragile context. So it wasn't just fragile context. We also narrowed it down by did this study have an intervention? And while there were a good number of studies, they didn't really fit what you would hope for a high quality data set of information about interventions in these contexts. And then with climate, um, I think one of the things that was challenging was there wasn't a lot about solutions. It was a lot about what the impacts of climate change are on facilities, like how they responded to a specific flood, how they responded to a specific drought. Um, and sometimes there would be kind of a niche technology that would be tested, but usually it was not solutions focused. So I think having these reviews was really helpful because it kind of showed us what the state of the evidence was in these smaller pockets of research. Um, and I think I would encourage others to kind of do the same thing with their own interests within wash-in healthcare facilities, environmental health conditions in healthcare facilities. And that kind of allows you to figure out what the bounds and the research questions that you need to dive in for more exploratory research, a next step. It's a very useful framing exercise, and we're excited to report on the findings and publish those hopefully in the next few months.
Thanks, Nikki. Darcy, any quick reactions, thoughts?
Yeah, I think the biggest thing for me about this evidence map is that you can trace the line of evidence that it might follow as a country is actually progressing towards reaching universal coverage. So we could see that there's a lot of evidence on coverage. There's some evidence on interventions, but as we progress farther down that chain of practical steps, we get less and less and less information. And one of the things that I would love for people to use this evidence map for would be in collaborations between researchers and NGOs and their monitoring, evaluation, and learning programs to really look at the gaps in the evidence and say, okay, where is your country or where is your NGO in this process of implementation? Where do you need information? Where can we find existing evidence and not reinvent the wheel? Okay, maybe we look at what's available on coverage. Okay, great. Maybe we prioritize target areas using that. And I think the place that we really see we're missing is some of those more applied policy focused steps. For example, around costed roadmaps and how do different stakeholders communicate between government, non-governmental implementers, to develop costed roadmaps and move these interventions to actually be sustained in practice. Yes, large-scale trials and similar quasi-experimental, rigorous academic evaluations are fill an important space in the evidence landscape, but they're not the end all be all. Just because we run a million trials doesn't necessarily isn't sufficient to get us to the end of the line for universal coverage. So I would love to see more research, particularly in partnership with non-academics, to fill those later steps in the translation from, soup to nuts, um, monitoring coverage up through sustained services.
Great. Thanks, Darcy. Great insight. Lucy, any reactions on evaluations and also your broader work? Because there's a lot of other stuff that you're doing that I think is key to advancing this agenda.
Yeah, thanks, Ryan. Yeah, so I think one thing that came out in the evidence map that was interesting to me was also, like Darcy alluded to, a little bit less research around interventions compared to the baseline assessment or situation analysis research. Um, and one of the things that I've been thinking a lot about is how do we move forward both on what types of impact we actually measure from environmental health services, as well as how we're measuring these impacts and designing interventions. So there are a lot of people here on this webinar working globally on programs to advance environmental health services, but might not always be having, a lot of funding to conduct an RCT or actually be able to monitor this at maybe the standard that some researchers would expect. But we're really interested in thinking about like lower cost, lower lift monitoring strategies. So one thing that I've explored is using health information system data, so routinely collected data that countries report in their national health monitoring systems, and actually using that to look at trends over time in healthcare utilization or health outcomes and how those might be impacted by implementing an intervention. So that's one example of how it doesn't need to be something where you're going out and collecting huge amounts of data yourself if you're able to leverage some of these pre-existing information systems that have relevant information. And then also thinking more broadly about what we actually measure as impact. So we often do think about health impact in the watch field, but these interventions also have a lot of other impacts for individuals and communities on things like health seeking, patient satisfaction, healthcare worker well-being. I've also been working on some surveys with healthcare workers to try and understand more about how environmental health services impact their job satisfaction and perceived safety at work. So I would also love to see more research that's exploring these different types of outcomes and thinking about the different and very broad ways that environmental health services can make an impact.
Yeah, that's
Thanks.
a great insight, Lucy. I think one of the things in the era of showing return on investment is the need to capture the full scale of benefits, and I think um, we neglect other benefits that are accrued from high quality wash services in healthcare facilities because we're oftentimes laser focused on healthcare acquired infections or other health related outcomes. And there's a number of other indicators that I think need to be explored. Even just anecdotally, thinking about the cost of the health system of healthcare worker turnover from dirty facilities is another key factor. So yeah, great insights, everyone. There was one question that came in, if anyone has any quick reactions based on what we've looked at. But I mean, are there any sort of, if there were randomized controlled trials done, what do you think might be a worthwhile investment in sort of a specific intervention to test or look at? If anyone has any quick reactions.
I can jump in. Um, One of the benefits, so this is a bit of a cop out. I would love to start to see consideration of context and target population
Hmm.
incorporated into these um, impact evaluations, randomized trials. So, for example, I would encourage use of the evidence map to look at the intersection of, for example, fragile contexts and interventions. So, the
Hmm.
types of interventions that we have evidence for in fragile contexts versus not fragile contexts gives us the opportunity to develop better tailored RCTs that increase the chances that these technologies are actually going to translate into practice after the RCT is completed. So I would encourage perhaps a slightly more complex question that first identifies a target population and a target context, and then examines what is the need and what is the evidence that already exists in that population and that context, and then look at potential technologies for trialing and impact evaluation once you've narrowed down the focus a bit.
Great, thanks. Lucy or Nikki, any other thoughts? I'll just echo Lucy's work. I do think there are a number of other opportunities, and we're really excited to share her work to leverage health records data, DHIS2, health management information systems, and also just routine program monitoring data that can be used in an experimental context to show the impacts of programs. Um, it's a good, from an implementer's perspective, it's a good reminder that collecting good data on implementation timeline, good internal program monitoring and evaluation data can be reused for alternative purposes. Oftentimes, those data get used for reporting to donors, but they can be repurposed in combination with other data sources to show actual impacts of programs. So, if anyone on the call is interested in this, we'd be happy to talk more. And again, we're excited to eventually share those results and talk more about the how to apply those learnings in other contexts. I'm not seeing many other questions in the chat, so I'll go ahead and just wrap us up here so we can get out on time. But thanks, Lucy, for presenting, and Darcy and Nikki for jumping in. Please sign up for the FVO working group if you haven't already and are interested. Nikki just dropped that in the chat. Again, our next webinar we have a webinar scheduled in July. And yeah, thanks for joining. We look forward to sharing all these resources and be in touch if you have any questions about evidence. Thanks everyone for joining. Take care and have a good rest of your day.